This is Dr. Punit Jain. I'm a consultant hematologist and a transplant physician at Apollo Hospitals, Navi Mumbai. Today I'm going to talk to you about sickle cell anemia. Uh, Sickle cell anemia is a deadly disease. It may not kill you immediately, but it kills you slowly. It's a condition where your blood cells in your body, they take the shape of a sickle, and they are not able to transfer the oxygen well enough to the tissues, ultimately causing damage to the tissues. You can land up with recurrent bony pains because of lack of oxygenation. You can land up with kidney failures. You can land up with strokes. You can land up with uh, failure of your functioning of the heart. It basically can damage a lot of organs in your body. What is important is an early identification. When you get probably married, it's important to know whether your spouse is a sickle cell trait. It's a very common disease. We find that in India, and I know it is very common in Africa. Early identification will help you do something what we call as a prenatal diagnosis. If two sickle carriers are getting married and the woman is pregnant, then by around 2 and 2.5 months, it's important to do a prenatal counseling to know whether the fetus or the baby is a sickle cell disease. If there is a sickle cell baby with a full-blown disease, there is always a chance that you can consider an abortion and redo pregnancy. Ultimately, these children require two kinds of therapy. One is an allogenic transplant, which we can take a donor from the family, a haplodonor, or a matched sibling donor, or somebody who is an unrelated donor but a matched donor. Other kind of therapy is what we call as a gene therapy, which is still in early phases and only available in select countries. Today, the treatment of choice is a bone marrow transplant. It comes with its fair share of complications, but that is the definitive therapy that is the cure for this disease.